The words on the doctor's report were enough to bring any parent to tears. This child is presenting a developmental profile that is consistent with autism spectrum disorder. Leo Kanner, the child psychiatrist at Johns Hopkins University, and in 1943 he first described autism based on a sample of only 11 children. The features include an inability to relate to people or situations, poor or absent language skills, repetitive verbal echoing, an excellent rote memory, an obsessive desire for maintenance of sameness, a persevering repetitive behavior, such as fidgeting, good cognitive potential, and a normal appearance. By the 1950s and 1960s, Bruno Bettelheim became a leading expert on autism in the United States, although his doctorate was in philosophy. He believed that children sensed that their mothers were withholding love from them. As such, they regressed inwards towards themselves and fell back into autistic behavior. This theory became known as the refrigerator mother theory, and thankfully has been widely discredited. By the mid-1980s, the state of California started to see rates of autism rise. The Department of Developmental Services provides services for clients with autism, cerebral palsy, mental retardation, and epilepsy. Between 1987 and 1998, they saw the combined rates of those four diseases rise 70%. Autism, on the other hand, rose over 250%, while the state's population only rose by 20%. The highest rates were seen in the youngest age brackets. So the University of California did a study. In their final conclusions, they stated that this was a true increase in the rates of autism, and it was not influenced by changes or increase in population, nor in a diagnostic criteria. Of the 3 studies done prior to 1993, they generally agreed that rates of autism were around 1 in 2,500. However, in 2007, the United States Centers for Disease Control acknowledged that among 8-year-old children, the rate of autism was 1 in 150. So what does that number mean? Well, in Calgary, we have over 1 million people here. For every 1 million children born in North America in 1999, over 6,600 children developed autism. Other countries started seeing similar rises in their rates. Iceland, Sweden, Finland, Denmark, Australia, Japan, and our own Canada. A shocking statistic came from an area in England in 2006. Based on 57,000 children, they had a rate of 1 in 86. Just a staggering number. Autism is a disabling condition that, if left untreated, means a lifetime of care. It is estimated that each person with autism can cost health and social services between $3 and $5 million. If no more children were born with autism from today, the total cost is still in the trillions of dollars. And yet funding for autism is still minuscule. Leukemia affects 1 in 25,000 kids. However, they receive $310 million. Muscular dystrophy affects 1 in 20,000, and they receive $175 million. Pediatric AIDS affects 1 in 8,000, and they receive $394 million. Autism affects 1 in 150, and they receive $15 million. The most widely researched topic in autism is genetics. In 1997, the first of several studies were done on autism in twins. They found that generally, if one twin had autism, the identical twins shared the disease in about 75% of the cases. For non-identical twins, the rate was about 15%. By 2001, they found autism locations on 21 of the 24 chromosomes. One location has to do with brain maturation, immune system, and the gastrointestinal repair. Well, why is that important? Autoimmune type diseases such as type 1 diabetes and lupus are very common in close and immediate family members of autistic children. Your gastrointestinal tract comprises 80% of your immune system, and many children with autism show signs of gastric distress, including chronic stomach aches and diarrhea. Now, while there's a strong genetic susceptibility, the fact that 100% of the twins do not share the disease means that there must be other factors. However, this has been largely ignored when you consider that most of the funding goes into genetics. How the genes affect the biochemical pathways within the body can really help us understand how this disease progresses. However, many leading experts now agree that how the environment triggers those genetic variations, and then how the body reacts, and the combinations of those show the most promise for effective treatments. Dr. Brian Jepson, an MD, says that autism is a disease of disordered biochemistry and metabolism that affects multiple organ systems and is treatable. Based on my own research, I would describe autism as a set of multifaceted symptoms of a very complicated disease. It affects mainly those with a genetic susceptibility to a weakened immune system or gastrointestinal tract. Pathogens or antibiotics can weaken that GI tract, thereby giving the opportunity for toxins, including mercury, aluminum, or lead, or other pathogens to enter the bloodstream. Those toxins or pathogens can also enter the bloodstream through the direct injection of a vaccine. Once inside the body, the invaders make their way to the brain, where because of the weakened immune system, they're able to cross the blood-brain barrier and inhibit neurological development. I believe in most cases autism is treatable and curable. From a medical standpoint, the key is to address the immune system, the GI tract, and the removal of toxins from the body. And that is exactly what we are doing. For that doctor's report that I mentioned at the beginning, is for my eldest son, Logan. Through a combination of behavior and medical treatment, we are seeing a lot of great improvements in a lot of areas. And that is enough to give any parent hope for the future.